Hello and welcome to Med4Care. I am Dr. Care and today's topic will be cystitis. Let's find out together what are its causes, its symptoms, and its treatment. What is cystitis? It is defined acute if it resolves in a single episode, or chronic if it tends to recur and become chronic. Cystitis is inflammation of the bladder and urinary tract. It is a very common disorder, especially among women, who are affected up to 10 times more than males. This happens because the female urethra is shorter than the male one, and this facilitates the ascent of bacteria to the bladder. Indeed, it is estimated that 40% of the female population has had at least one attack of cystitis in their lifetime. Causes. For cystitis, we tend to distinguish between two types of causes, bacterial and non-bacterial. In fact, most bladder inflammation is caused by bacteria, and therefore it is bladder infections. The bacteria coming from the rectum that can reach the bladder both from the outside and from the inside through the walls of the organs are responsible for the bacterial invasion of the urothelium of the bladder. When the bacteria even manage to reach the ureters and kidneys, we speak of pyelonephritis. In particular, female urinary tract infections are in 86% of cases due to Escherichia coli. Other bacteria responsible for urinary infections are Staphylococcus saprophyticus, Klebsiella, Proteus, Enterobacter, Citrobacter, and Enterococcus. The use of the urethral catheter in hospitals is one of the major risk factors for contracting bacterial cystitis. A woman's age is an important factor since with advancing age there is a reduction in estrogen production with a consequent increase in pH, which promotes the colonization of gram-negative enteric organisms such as E. coli. If, on the other hand, no bacteria are found in the urine, it is called abacterial or non-bacterial cystitis. In these cases, bladder inflammation is mostly attributable to chemical irritation. For example, it can be linked to the recurring consumption of irritating foods, high acidity of the urine, chronic dysfunction of the pelvic walls called interstitial cystitis, constipation, the use of synthetic or too tight clothing. Symptoms. In the case of cystitis, the walls of the urinary tract become inflamed, mainly causing pain and burning when urinating. Other common symptoms are pain and heaviness in the lower abdomen, pain and burning both during and after urination, painful spasms of the muscles, bladder tenesmus, difficulty in passing urine, feeling of incomplete emptying, constant need urinating, polyuria, and sometimes urge incontinence. Sometimes there is also hematuria, that is the presence of blood in the urine. Fever, headache, and nausea may also occur, especially if the infection is significant. In some cases there is no symptom but only the presence of bacteria in the urine is found. Diagnosis. During the medical history, the doctor collects and critically reprocesses all the information useful for framing the patient's ailment. On physical examination, purulent secretions or pyuria, that is, the presence of pus in the urine, can generally be seen. If the patient is in great pain and also has fever, tachycardia, and flank pain, it could be pyelonephritis, which, in some cases, develops as a result of neglected or not properly treated cystitis. In this situation, the presence of possible renal inflammation can occur with the Giordano maneuver. To confirm the presence of cystitis, some laboratory tests are also usually prescribed, such as chemical, physical, and microscopic examination of the urine culture useful for verifying the presence of bacteria in the urine, and antibiogram, necessary when the presence of bacteria is found, to verify the type and sensitivity to antibiotics. In general, it is also important to assess whether there are any anatomic or systemic factors that increase the severity of the infection. Indeed, in this case we speak of complicated cystitis. Among the main factors are male sex, diabetes, immunosuppression, polycystic kidney, acquisition of infection in hospital, obstruction of the outflow of the bladder, neuropathic bladder, catheterization or ureter stent, ureterolithiasis, genitourinary surgery, neoplasm, vesicoureteral reflux. Therapy and prevention. The choice of cystitis treatment depends on the duration and type of infection. In the case of bacterial cystitis, antibiotic therapy is used, while in the case of interstitial cystitis, the treatments can be multiple and of different nature, including oral or intravesical therapies aimed at restoring the integrity of the urinary epithelium. The choice of an antibiotic depends on its effectiveness, the risk of adverse effects, the resistance rates, and risk of collateral damage. Before taking an antibiotic, it would be advisable to perform an antibiogram to evaluate its effectiveness in the specific case. For example, among the antibiotics used in acute uncomplicated cystitis are nitrofurantoin, trimethoprim sulfamethoxazole, ciprofloxacin, levofloxacin, beta-lactams such as amoxicillin clavulinate. However, prevention remains one of the most effective weapons. Nutrition in this sense is essential. In particular, it is advisable to drink at least 1.5 to 2 liters of water a day. Decrease the consumption of carbohydrates and eliminate junk food, avoid spicy foods and irritating foods such as chocolate, sweets, and sausages. Proper intimate hygiene is also central to preventing the translocation of bacteria from the posterior to the anterior region. The bidet, especially after sexual intercourse, is very important, although, on the other hand, it is necessary to avoid an excessive daily washing. In this sense, clothing is a factor to be considered. It is advisable to avoid tight and synthetic underwear and to prefer breathable cotton instead. Likewise, it is not recommended to wear tight-fitting trousers and synthetic tights or leggings. Physical activity can also play an important role since it helps strengthen the immune system and promote intestinal motility. Finally, food supplements based on American cranberry, bearberry, and D-mannose and vaginal and oral lactic ferments are particularly effective in prevention of cystitis. We are now at the end of today's video. We hope you enjoyed it. If you found it useful, please support us with a nice like and subscribe to the channel. See you soon on Med4Care.